So Sherry, what procedures did you do with Dr. Marifat?
I've had a few done. I had my upper and lower eyelids done. I had my inner thighs liposuction and my stomach liposuction.
And why did you do these procedures?
Mainly just for myself, to feel better about myself, to feel more confident and comfortable in my own skin.
Mm. And all in all, how do you think the procedures went?
Fabulous.
So you do them again?
Absolutely.
If you had to?
Absolutely.
How long did it take, like after, for example, let's talk about your liposuction. How long did it take before you were back into your normal routine?
Completely, well, 3 days after my surgery, I helped my brother move into his house and I was doing their pantry. So I was like 3 days and I was up moving around with, you know, a little bit of limited, but for the most part, just normal stuff.
And what about your thighs and your liposuction done on the same day, same procedure?
My stomach and thighs, yes.
And within 3 days you were back to...
It wasn't like full 100%, but I was up moving around and doing normal stuff within 3 days.
Would you say that it hurt, the recovery?
I wouldn't say that it hurt. I would say that it was uncomfortable for a little while. And just, you know, when my skin was going back, you know, kind of reconnecting, that kind of thing after liposuction, taking off the garment. I really enjoyed having that garment on.
Are you happy that you've done these procedures?
Absolutely. Oh yeah, for sure.
Do you feel like it's like given you more self-confidence or just made you more comfortable?
All of that. More self-confidence. I'm more comfortable with the way that I look and feel. You know, I exercised all the time and still nothing with I couldn't get my stomach to do, my thighs to do, and so it's even motivated me more to continue to stay in shape.
Mm-hmm. So I already asked, but you would do it again?
For sure.
Okay. And then what did you think of like having Metropolitan Plastic Surgery perform your operation?
Well, I wouldn't go anywhere else.
Aw. What do you think of Dr. Marifat as a surgeon?
I think he's fantastic. I mean, I look at him as being an artist in that he looks at your body as a work of art. Mm-hmm. And so he kind of interprets that into his work as well.
And incorporates it into his...
Mm-hmm.
And then if someone else wants to get the similar kind of procedures that you did, what kind of advice would you give them before going into their surgery, or what would you warn them about?
I don't know that I would necessarily warn them about anything. I would just say that the best advice would just be to go ahead and do it. Mm-hmm. I just know that it has really helped me a lot, just in the way that I feel about myself and the way that I look at myself. And I would just, I wouldn't warn them about anything.
How long was the recovery period for the eyelid surgery?
I had my upper and lower eyelids, I guess total was probably about a month. Complete recovery with no bruises, no signs of anything.
And then after how many days was it right after the surgery that you were able to kind of, you know, do things a little bit back to normal? Like,
well, let's see. I think I had my surgery the day before Thanksgiving, and then Thanksgiving Day I went and had dinner with my family. So I was in glasses and sunglasses, and I looked like Miss Hollywood. But, it was right away. You know, I just got back into my regular routine the day after. I mean, I wasn't 100%, but it was right away.
And you mentioned that your liposuction thigh surgeries were more discomfort. What about for the eyelids?
I wouldn't say, again, I wouldn't say that it was painful. It was just uncomfortable for about a week. Mm-hmm. And then after that, you know, it started just, you didn't really notice as much. I mean, I still had a little bit of bruising, but I just wore my glasses and it was no problem. And once I could start putting a little bit of makeup over top of it, then you couldn't even tell.
How long did you wait before you put makeup on?
I think it was like a week or maybe a week and a half.
Mm-hmm.
Yeah.
Do you think that it's because like your face, I mean, everyone interacts with your face, you know? So I feel like any kind of changes that you do to anything that you were remotely self-conscious about on your face is going to have a huge effect. You know, for example, like I suffered from acne for a long time, and while I had it, I was just very, very self-conscious, and I was constantly thinking about it. Do you think that this is kind of eased, if you had any of that self-conscious, that it's eased that you're
Oh yeah, and it was for me. If not for anybody else, it was more comfortable for me.
So you did this procedure for yourself?
Absolutely. Yeah, I had, circles and bags under my eyes. It's hereditary. That my upper lid was sagging, and I'm not that old. And so it was just a great experience for me to feel more comfortable looking at myself. It wasn't really for anybody else, but for me.
Thank you so much.